Okay, well, thank you for this opportunity. My name is Isao Teshirogi, the President CEO of Shionogi and Company Limited, the Japanese pharmaceutical company, pretty much just specializing in infectious disease area. I think we've been developing the COVID-19 oral pill and vaccine and so on. And at the same time, the my company, has been very much committed to global health since the this pandemic happens more and more. Actually, infectious disease is not the handled by many mega pharmaceutical companies, simply because I would say it is not as profitable as the other pharmaceutical business, the therapeutic areas. But again, we have 145 years of history, and we've been doing this infectious disease longer than 60 years. We feel committed more and more for the infectious disease. The attendance toward this meeting begins from the meeting with the Dr. Peter Lam when he visited our company last year. He truly emphasized the value of the Hong Kong, and of course we as a company, very interested in the China and other Asian territories. I think it really gives us the perfect opportunity to show up, make a good presence as a Japanese pharmaceutical company, and at the same time, like to have the good connection with the Asian leaders or global leaders attending this conference. So I think the global health definitely is going to be next era's agenda. I think even this pandemic opens up the huge benefit of innovations such as messenger RNA vaccines, but at the same time the equitable distribution of the healthcare products was not as smooth as the people wanted to see. So I think unfortunately next pandemic will come. So we as a human society would like to do things much better than we did with this COVID-19. So that's another reason as an infectious disease company, we really need to commit ourselves for the global health agenda. So having said that, I really want to achieve what is the next most important agenda for the global health. Again, creating a pharmaceutical product is one thing, but at the same time, how we could achieve the more equitable distribution, speedy manner with the affordable pricing, thing. I think we really need to kick off the discussion amongst the society. Asia is definitely one of the most important global geography in the world without any doubt. I think we currently have the approximate 8 billion population in the globe, and people say that population may grow up to 10 billion by 2050, 2060, and the majority of the growth, like 2 billion, will come from both Asia and Africa. So that population is, I would say, the leading model for the human society, how we could do things much better. So working with the Asian society, Asian companies, Asian people are so important agenda. So again, we may meet with the certain countries, the leading companies. One of the themes we want to talk and achieve is how we could do clinical studies better in this growing population society. The panels of the clinical studies in Asia has not been well furbished yet. So another possible growth potential for the Asian business or healthcare business is how we could do clinical studies, how regulations will harmonize, get early approval, and deliver to products to Asian population as quickly as possible. I think all those things will be contained with this healthcare summit.